My name's Jim Rodriguez. I'm with TexHealth Central Texas, and what I'm going to do today is take you through a slideshow to tell you about TexHealth Central Texas, what we're about, and all the benefits of our program, and ultimately how to enroll in the program once you've decided that's the thing you want to do. Just to give you kind of a background and a frame why TexHealth is where it's at, nearly 350,000 Texans have lost health insurance in the past 5 years. 25.5% of the Texas population is uninsured, which is more than any other state in the union, and nearly two-thirds of small businesses do not offer health benefits to their employees. Who we are is we are a nonprofit. We're local to the Austin community. We're a 501c3 community-based health benefits program, and our mission in life is to provide coverage to the working uninsured, and we do that through their employer. We have a premium assistance program that lowers the cost. That means that we pay part of the cost. How do we pay for part of the costs? We do that through state grants. We provide this help for qualified employees. It's based on their income. 2 to 50 eligible employees is what it takes to qualify for a business. That can include the owners. So, for example, if you have a sole proprietorship and it's a husband and wife that own the business, we can sign up that particular business because there's 2 employees or 2 owners. It has to be licensed within Travis, Hayes, Williamson, or Burnett counties, and you cannot have offered group health insurance in the past 12 months. Now note the word group as opposed to individual, because we do have employers who oftentimes have an individual policy on themselves, but they can't afford a policy on their employees. So they are not disqualified from participating because they have an individual policy. They cannot have offered a group health insurance program in the past 12 months. 60% of eligible uninsured employees must enroll. Most small business commercial insurance programs require 75% participation. Ours is 60%, and that participation is uninsured employees. So let me give you an example. If you have 10 employees in a business, which includes the owners, and let's say those 2 owners have an individual plan, that means that they are not included in the 60% rule. Now we're down to 8 employees. Because we start out with 10, 2 have individual policies, that leaves us 8 who are uninsured. 60% of those 8 must enroll. 60% of 8 is 4.8 employees. Well, in our business we are allowed to round down, so in this case we would take 50%, which would be 4 employees. But if it turns out to be a round number that would not need to be rounded, we would be able to accept 60%. Employees that qualify are W-2 or 1099 employees of a business that does qualify. Employees can work an annual average of 20 hours per week to qualify. The employees cannot be enrolled in or eligible for a government program like Medicaid, Medicare. They must be a U.S. resident, but they can live outside the service area as long as the central office is in one of our 4 counties. We do use United Healthcare, as I mentioned earlier. They are the largest provider network in this region. You have 24/7 web access to myuhc.com. What you can do with myuhc.com, as you can see, is you can find a doctor, you can track your blood pressure, find a hospital, look up your claims, you can order prescriptions online, you can chat with the nurse, you can do all these things, including replace your ID card and set up your own personal wellness program. All of these things are available to you through myuhc.com. One thing I would note at the very bottom here where it says it all adds up to peace of mind, right below that it says the choice plan. When you go to myuhc.com and you want to access all these benefits that are available to you, it will ask you what program are you in, and there will be a long line of or a long list of a variety of programs that United Healthcare offers to its membership. Ours happens to be the choice plan. So just keep that in mind if you need to go out there and print off your ID card or access one of these other wonderful benefits. This is the benefit plan I'd like to go through with you. If you look at this, the annual year, calendar year deductible is at $250. We're basically a $250 80-20 plan. 20% is the member share or co-insurance in insurance lingo. Maximum out-of-pocket is $5,250 as long as you don't exceed the annual calendar year maximum per person, which is $130,000, which means we will pay up to $130,000 per calendar year for each of our members. Hospital benefits, all of these things, hospital inpatient stay, outpatient hospital surgery, all of these things except emergency room are covered by the $250 plus 20%. Emergency room is a flat $250 copay, and it's not applied to the annual deductible. Copays and deductibles don't mix, so what that means is if you go into the emergency room and you're seen and you're discharged the same day, there's a $250 copay that does not apply to your deductible. If, however, you go in the emergency room and they admit you as a result of that visit, the $250 would not be a copay anymore. It would be the deductible if you hadn't paid the $250 before that calendar year. You pay $250 once during the calendar year. Physician benefits in office is the next area we get into with copays. We do offer one annual exam, physical. It's a well check, and the copay is waived. Otherwise, you have 8 visits that are covered annually for physician office visits, $20 copay for primary care, $40 for specialist. Neither one of those apply to the deductible. Maternity, many of your individual plans in the commercial insurance market do not cover maternity, but we do. It's subject to the specialty copay for initial prenatal visit. What that means is you pay the first visit copay to your doctor when you're diagnosed as being pregnant. From there on, all copays are waived for future prenatal visits, and there is no limit to the number of visits you can use. Keep in mind that we do not cover dependents on this program. This is an employee-only coverage, so baby would not be covered after birth, but mom would be covered all through up until delivery. Speech and hearing exams are covered in the physician office visit. Physical therapy, occupational therapy, cardiac rehab therapy. Many of our therapies are covered with a $40 copay, 8 visits covered annually. That means these 8 visits are over and above the physician visits that we remarked about earlier. Podiatry is subject to the deductible plus 20%, and anything, the rest of these services, anything that is covered in the doctor's office is covered by the copay. The way to look at this is that the office visits are subject to the copay and 8 visits. Anything outside of the office are considered non-office visits, and they're subject to the $250 plus 20%. So if you have a physician that you go see, a doctor's office, and they do lab and x-ray in that doctor's office, that would be covered by the copay. If, however, the doctor doesn't have those services and they refer you out, even if it's for a blood draw, that would be subject to the $250 plus 20%. Again, $250 is only paid one time each calendar year. After that, it's 20%. Behavioral health services, inpatient behavioral health is subject to the deductible plus 20% co-insurance. Outpatient is $20 copay per visit, 10 visits per calendar year. Again, this is over and above the physician visits. It's over and above the therapy visits. Other services, prescription drugs, $15 generic, $35 brand formulary, and $50 brand, $1,000 per calendar year maximum. Now, $35 for brand formulary, what that means is, formulary means list. So if the brand is on the list at the pharmacy that is subject to the $35, that's all you would pay. We recommend to our members that they work with their doctor's office to see if any of the medications they're prescribed can be filled on one of the $4 programs out in the community. For example, Walmart, H-E-B, Randall's, and that way extends this benefit exponentially. Ambulance, home health care, and durable medical equipment are all subject to the deductible plus 20%. Medical supplies are a flat 20%, $1,000 calendar year maximum. Excluded services, like any other insurance program, commercial insurers also have exclusions. Most of these are the exact same thing that they exclude. So take a minute to look at these issues and these services that are not covered by Tex Health. We do have a pre-existing conditions clause, and what that says is that if you've had treatment, diagnosis, or recommendation for treatment in the 6 months prior to becoming eligible for Tex Health, we can exclude those services for up to 12 months. If you have asthma, diabetes, or hypertension, and we decide that it probably would be good for you to be in our care management program, we will invite you to join the care management program. And if you do, and if you participate in that, we will waive the pre-existing conditions clause for you because you are in the care management program. So the program, our program costs a flat $269 per month. There's a $100 grant that reduces the cost to $169. That is recommended to be split 50-50 by the employer and the employee, which makes it $84.50 per month. $84.50 paid by the employer, $84.50 paid by the employee. For the employee, that's about $21 per week. Now, the reason we recommend 50-50 is because the employer can apply for a tax credit, so it's a win-win for the employer. For the employee, the win is that they have half of their premium paid for by the employer, and everybody's got skin in the game. We don't have dental or vision coverage, but I want you to know that if you are in an accident, then there's damage to your teeth, we will cover up to $900 per tooth, maximum of $3,000 per incident. Same thing with vision. We don't cover vision, but eye exams at an ophthalmologist are covered. They're $40. Which is the specialist copay, and it will be one of your 8 visits, one of your 8 annual visits. But we do not cover glasses, and we do not cover the services of an optometrist, which is an OD. We can get you some supplemental dental and vision coverage through commercial insurance carriers. We do have access to them at a fairly low cost. If you would like for us to do that for you, please just call our office and we'll be happy to work with you. What happens when you offer benefits? You recruit better, more qualified employees, and the ones that your best employees generally stay with you longer if you've got benefits. It keeps them from looking at the competitor down the street who does offer benefits if you don't. It tends to keep your employees healthy, happy, and more productive, and that's been proven in many studies. This is what some of our current clients have to say about us. Matthew O'Hare, he's the owner of Vital Farms. They are a farm that produces organic eggs, and they're in the Austin area. And he says that we wouldn't have health insurance on a company-wide basis if it wasn't for Tex Health. It's been a great asset because once the employees have it, they really rely on it, and it becomes a great tool for luring employees in and retaining good employees. Enrolling in the program is really pretty simple. The employer needs to fill out an application form, and sign an employer agreement, agree to an electronic funds transfer agreement. From the employee side of the equation, though, we do have an employee application. We have an acknowledgement of benefit limits, and we have a personal medical history form that we ask you to fill out. And the reason we do that is to see if you're a candidate for our care management program. This is our website. We recommend that you go there if you'd like to hear more about our program. And what I want to do is direct you to the Customer Service tab. This is where you would access some of the forms. This is the application that would have to be filled out. The other form we would need you to fill out is the Acknowledgement of Benefit Limits form. This is the form I mentioned earlier where you acknowledge that you understand there are limits on this benefit program. The third form you would have to fill out is the Adult Personal Medical History form, and this would be reviewed by the nurse to determine if you're a candidate for our care management program. So those are the 3 forms that you would need to do. Feel free to contact us at any time with any questions. This is our information, and we'd be happy to work with you to get you signed up for the Tex Health program.